If you're over 50 and drinking clove tea, stop immediately, because you might be unknowingly putting your health at serious risk. What if I told you this seemingly harmless tea could be silently damaging your liver, causing irreversible digestive issues, or even triggering dangerous side effects you've never connected to it? It's true, and the scariest part? Most people have no idea they're drinking it the wrong way. But don't worry. By the end of this video, you'll learn how to avoid these dangers and protect your health. Before I dive deeper into this critical topic, let me tell you something shocking. 99% of the people watching this video aren't subscribed. If you value your health and don't want to miss out on more life-saving tips like this, make sure to hit that subscribe button right now. It's completely free, and it ensures you stay informed about crucial health advice, the problems and symptoms. Clove tea, when consumed improperly, can become a ticking time bomb for your health, especially if you're over 50. What starts as a seemingly harmless cup of tea can quietly wreak havoc on multiple systems in your body, leading to irreversible damage. Let's take an in-depth look at the extensive risks and examples of how this powerful yet volatile beverage can harm you when misused. The liver. Silent damage that escalates. The liver, often referred to as the body's detox powerhouse, is where clove tea's greatest danger lies when consumed improperly. At the heart of this issue is eugenol, the primary active compound in cloves. While eugenol has recognized benefits as an antioxidant and anti-inflammatory agent, overconsumption creates an overload for the liver, which is responsible for filtering toxins and metabolizing nutrients. When the liver is overwhelmed, it enters a state of hepatotoxicity, where liver cells become damaged and inflamed. Initially, you might experience subtle symptoms like persistent tiredness or sluggishness, which are easy to dismiss as normal aging. Over time, these escalate to more severe signs such as persistent nausea, loss of appetite, and discomfort in the upper right abdomen. As the condition worsens, the liver's ability to function decreases, leading to dark-colored urine, pale stools, and jaundice, a yellowing of the skin and eyes caused by an accumulation of bilirubin. If not addressed, this damage progresses to fibrosis, the formation of scar tissue, and eventually to cirrhosis, where the liver's structure and function are permanently compromised. Cirrhosis can result in life-threatening complications such as internal bleeding, fluid accumulation in the abdomen, and even liver cancer. For those already at risk, such as individuals with non-alcoholic fatty liver disease, a history of alcohol use, or those taking medications like acetaminophen, paracetamol. Even small doses of improperly prepared clove tea can accelerate liver damage. Imagine relying on this tea daily, thinking it's a health tonic, while it silently damages the organ that keeps your entire body running smoothly. Compounding this, eugenol is metabolized differently by individuals based on genetic factors. What might be a safe amount for one person could prove toxic for another. This unpredictability underscores the importance of precise preparation and limited intake. The liver doesn't show outward signs of distress until it's significantly compromised, making this risk particularly insidious. Digestive system, a delicate balance disrupted. The digestive system is one of the first areas to feel the effects of improper clove tea consumption, as the tea's potent essential oils can irritate the sensitive tissues lining the stomach and intestines. These oils, especially in high concentrations, are highly reactive and can disrupt the natural protective barriers within the gastrointestinal tract. When consumed without proper dilution or on an empty stomach, clove tea can cause acute gastric irritation. Early symptoms include heartburn, a burning sensation in the chest or throat caused by acid reflux, and indigestion, where meals feel heavy and uncomfortable in your stomach. Over time, this repeated irritation can inflame the stomach lining, leading to gastritis, a condition marked by chronic pain, nausea, and bloating. If this inflammation is not managed, it can progress to peptic ulcers, which are open sores in the stomach or small intestine. These ulcers cause sharp, stabbing pains that intensify after eating or drinking. Left untreated, they can bleed, leading to symptoms like vomiting blood or black, tarry stools, both of which signal internal bleeding. In the most severe cases, ulcers can perforate the stomach or intestinal wall, spilling digestive contents into the abdominal cavity, a medical emergency known as peritonitis that requires immediate surgery. Consider the scenario. You start each day with a cup of clove tea, thinking it will aid digestion. Over weeks or months, you begin to notice persistent stomach discomfort that escalates to full-blown pain. What you thought was a healthy habit has, unbeknownst to you, led to a condition requiring invasive medical intervention. The risk is higher for individuals already dealing with digestive conditions, such as acid reflux, irritable bowel syndrome (IBS), or Crohn's disease, as clove tea can exacerbate their symptoms. Additionally, consuming the tea in concentrated forms can interfere with the natural balance of digestive enzymes, further slowing down your body's ability to break down food properly, leading to chronic bloating and discomfort. Blood clotting, a hidden risk for unexpected bleeding. Clove tea's natural anticoagulant properties can turn from helpful to harmful when consumed improperly. At the center of this issue is eugenol, a compound that thins the blood by inhibiting platelet aggregation, a process essential for forming clots. While this effect may seem beneficial in preventing clots that can cause heart attacks or strokes, excessive consumption of clove tea can severely impair your body's ability to stop bleeding. For individuals who consume clove tea regularly, signs of excessive blood thinning can manifest as frequent nosebleeds, unexplained bruising, or prolonged bleeding from small cuts or scrapes. Imagine accidentally nicking your finger while chopping vegetables, only to find the bleeding doesn't stop for hours. This may seem trivial at first, but it indicates a deeper issue within your body's clotting mechanisms. The risks are significantly higher for people on anticoagulant medications like warfarin, aspirin, or heparin. The combination of these drugs with clove tea can amplify the blood thinning effects, increasing the likelihood of internal bleeding. For instance, even a minor bump or fall could result in a massive bruise, or worse, internal hemorrhaging. In the most severe cases, bleeding in the brain, known as an intracranial hemorrhage, can occur, which is often fatal or leads to permanent disability. Consider this real-life example. An older individual, already on blood thinners for a heart condition, adds clove tea to their routine for its perceived health benefits. A slight tumble results in an undetected internal bleed in their abdomen, causing weakness and severe pain over days. By the time medical intervention occurs, the damage is extensive, requiring hospitalization and invasive procedures. Additionally, clove tea's anticoagulant effects can interfere with natural healing processes. For instance, after a surgery or dental procedure, where clotting is critical to recovery, clove tea could slow healing, increase the risk of infection, or even cause post-procedure bleeding. The risk isn't limited to those on medications. Individuals with clotting disorders, such as hemophilia or von Willebrand disease, face heightened danger, as their bodies are already struggling to form clots effectively. Even without these conditions, consuming high amounts of clove tea regularly can lead to subclinical, hidden, bleeding in the digestive tract or joints, which manifests as pain, swelling, or fatigue over time. Blood sugar regulation, the double-edged sword. Clove tea is often praised for its ability to lower blood sugar levels, making it a popular choice among individuals seeking natural remedies for diabetes or metabolic syndrome. However, when consumed improperly, it can dangerously lower blood sugar, leading to hypoglycemia, a condition that occurs when glucose levels in the blood drop below the body's required threshold. Hypoglycemia can develop quickly and without warning. Early symptoms include shakiness, sweating, confusion, blurred vision, and lightheadedness. Imagine drinking clove tea to manage your blood sugar, only to find yourself struggling to focus at work, feeling weak and disoriented. If hypoglycemia progresses untreated, it can escalate to more severe outcomes, including seizures, loss of consciousness, or even a diabetic coma, which can be life-threatening. For individuals managing diabetes with medications such as insulin or oral hypoglycemics, clove tea poses an additional risk. The tea's blood sugar lowering effects can amplify the action of these drugs, creating a dangerous situation where glucose levels plummet unpredictably. For instance, a diabetic person might experience a sudden crash in blood sugar after drinking clove tea following their usual dose of medication, leading to an emergency. Let's consider this scenario. Someone without diabetes but prone to hypoglycemic episodes adds clove tea to their daily routine, thinking it's a safe and healthy choice. Over time, they begin to notice symptoms like irritability, dizziness, and difficulty concentrating, not realizing that their blood sugar is dropping to unsafe levels. This person may eventually collapse during physical activity, such as exercise, due to insufficient glucose to fuel their body. Additionally, hypoglycemia isn't just a short-term problem. Frequent or prolonged episodes can cause lasting damage, including impairments in brain function. Chronic low blood sugar affects memory, cognitive performance, and even emotional well-being, contributing to anxiety or depression. For non-diabetics, the risk of hypoglycemia from clove tea increases if consumed in large quantities or on an empty stomach, as the body has fewer reserves to stabilize blood sugar levels. Other factors, such as skipping meals or engaging in intense physical activity after drinking the tea, can exacerbate these effects, leaving the body unable to recover its glucose balance. Allergic reactions, rare but deadly. While clove tea is generally safe for most people, it can trigger allergic reactions in a subset of individuals, and these reactions can range from mild discomfort to life-threatening emergencies. The body's immune system may perceive certain compounds in clove tea, particularly eugenol, as harmful invaders, prompting an allergic response. Mild allergic reactions often manifest as itchy skin, redness, rashes, or hives shortly after consuming the tea. These symptoms, while unpleasant, are usually manageable with over-the-counter antihistamines. However, they serve as an early warning that your body is reacting adversely to clove tea. For some, the reaction can escalate to angioedema, a condition where deeper layers of the skin swell, often affecting the lips, tongue, and throat. Imagine taking a sip of tea and suddenly feeling your throat tighten, your tongue swell, and your breathing become labored. These symptoms indicate a serious allergic reaction that requires immediate medical attention. The most severe form of an allergic reaction is anaphylaxis, a medical emergency that can occur within minutes of exposure. Signs of anaphylaxis include difficulty breathing, swelling of the throat, rapid heartbeat, a sharp drop in blood pressure, and loss of consciousness. Without prompt administration of epinephrine and EpiPen and emergency care, anaphylaxis can be fatal. Consider the story of a person who enjoys herbal teas and decides to try clove tea for its health benefits. Within moments, they begin to feel dizzy and notice their throat swelling, but they're unaware they're experiencing anaphylaxis. By the time they call for help, their symptoms have worsened and they require hospitalization to recover fully. It's important to note that allergic reactions can sometimes develop over time, even if you consume clove tea safely in the past. Repeated exposure to allergens can sensitize the immune system, making future reactions more likely or more severe. This phenomenon is known as sensitization, and it underscores the importance of monitoring how your body responds to clove tea over time. Additionally, cross-reactivity with other allergens is a possibility. For example, individuals allergic to allspice, nutmeg, or other members of the Myrtaceae family may be more prone to reacting to clove tea. This means that if you've experienced allergies to spices or other plant-based foods, clove tea might not be as safe as it seems. Gut microbiome. Killing the good along with the bad. The gut microbiome, a complex ecosystem of beneficial bacteria, fungi, and other microorganisms in your digestive tract, plays a critical role in maintaining overall health. Clove tea, with its strong antibacterial properties, can disrupt this delicate balance if consumed improperly or in excess. While clove's antibacterial effects can help combat harmful pathogens, they can also inadvertently kill off the good bacteria essential for digestion, immunity, and nutrient absorption. When the microbiome becomes imbalanced, a condition known as dysbiosis occurs. Symptoms of dysbiosis can vary but often include chronic diarrhea, constipation, abdominal pain, and persistent bloating. Imagine starting each day with clove tea, only to find yourself frequently uncomfortable, unable to predict how your digestive system will respond to even the simplest meals. Over time, the consequences of dysbiosis can extend beyond the digestive tract. For instance, a reduction in beneficial bacteria can weaken your immune system, leaving you more susceptible to infections. You might notice that you're catching colds more often or recovering slower from illnesses, all because the balance of your gut microbiome has been disrupted. One of the most concerning long-term effects of dysbiosis is the development of leaky gut syndrome. In this condition, the lining of the intestines becomes more permeable, allowing undigested food particles, toxins, and harmful bacteria to enter the bloodstream. This triggers systemic inflammation, which has been linked to chronic health issues like arthritis, autoimmune diseases, and skin conditions such as eczema or psoriasis. Consider this scenario. A person regularly consumes clove tea for its perceived health benefits, but begins experiencing unexplained fatigue, joint pain, and skin flare-ups. They visit multiple doctors, undergoing tests for various conditions, only to find that the root cause is an imbalanced gut microbiome, worsened by daily clove tea consumption. The disruption of gut bacteria can also impair the production of essential nutrients. For example, certain gut bacteria produce vitamins B12 and K, which are vital for energy production and blood clotting. An imbalance can lead to deficiencies, manifesting as symptoms like extreme tiredness, weakness, easy bruising, or even bleeding gums. The risks are particularly high for those with pre-existing gastrointestinal conditions, such as irritable bowel syndrome, IBS, or Crohn's disease, as their digestive systems are already sensitive to disruptions. For these individuals, clove tea can exacerbate symptoms, leading to more frequent flare-ups and reduced quality of life. To compound the issue, the overuse of clove tea might also reduce the diversity of gut bacteria. A diverse microbiome is key to resilience and adaptability in the face of dietary changes or illness. Imagine narrowing your body's defenses against digestive challenges, leaving you vulnerable to imbalances triggered by minor changes in diet or stress. Nutrient deficiencies, the hidden cost. Prolonged consumption of improperly prepared clove tea can interfere with the body's ability to absorb essential nutrients, leading to subtle yet serious health problems over time. The disruption in nutrient absorption is primarily due to clove's antibacterial properties and its potential to irritate the digestive system, which together create a hostile environment for proper digestion and assimilation of vitamins and minerals. One of the most common deficiencies linked to improper clove tea consumption is iron deficiency anemia. Iron is crucial for producing hemoglobin, the molecule that carries oxygen in your blood. When the digestive system is irritated or the gut microbiome is imbalanced, the body's ability to absorb dietary iron decreases significantly. Symptoms of anemia include persistent fatigue, pale skin, shortness of breath, brittle nails, and in severe cases, dizziness or heart palpitations. Imagine feeling chronically tired and unable to perform daily activities, unaware that your cup of clove tea is contributing to this energy drain by reducing your iron absorption. Another critical nutrient affected is calcium, which is essential for strong bones and teeth, as well as proper muscle function and nerve signaling. A reduction in calcium absorption can lead to osteopenia, low bone density, and eventually osteoporosis, where bones become fragile and prone to fractures. Consider this scenario. A person in their 50s starts drinking clove tea daily for its health benefits, only to find themselves with a minor fracture after a seemingly harmless fall, a direct consequence of weakened bones caused by chronic calcium deficiency. Vitamin B12 absorption may also be impaired due to the impact of clove tea on stomach acid production. B12 is essential for maintaining nerve health, red blood cell production, and DNA synthesis. Deficiency in B12 can result in symptoms like numbness or tingling in the hands and feet, memory problems, and even mood disturbances such as depression. For older adults who are already at a higher risk for B12 deficiency due to reduced stomach acid production, clove tea can exacerbate the problem. Vitamin K, which is vital for blood clotting and bone health, can also be affected. A lack of this vitamin may lead to symptoms such as easy bruising, nosebleeds, or excessive bleeding from minor cuts. Additionally, the weakened gut microbiome caused by clove tea can reduce the production of this vitamin by gut bacteria, further compounding the issue. Even trace minerals like magnesium and zinc may be affected. Magnesium is essential for muscle function, neurotransmission, and over 300 enzymatic reactions in the body. Deficiency can cause muscle cramps, irritability, sleep disturbances, and even irregular heart rhythms. Zinc, on the other hand, supports immune function, wound healing, and taste perception. Reduced zinc absorption can lead to frequent infections, slow healing of cuts or wounds, and a diminished sense of taste or smell. The problem becomes even more pronounced when clove tea is consumed on an empty stomach or in high concentrations, as the essential oils can irritate the stomach lining and further hinder nutrient absorption. Imagine a person experiencing chronic fatigue, brittle bones, and frequent colds, unaware that their daily clove tea habit is quietly undermining their health by robbing them of critical nutrients. The risks of nutrient deficiencies are especially high for those already dealing with dietary restrictions or conditions that affect absorption, such as celiac disease, Crohn's disease, or gastric bypass surgery. For these individuals, even small disruptions in nutrient intake can have amplified consequences. Chronic inflammation, the root of major diseases. Improper consumption of clove tea can trigger chronic inflammation, a condition where the body's immune response remains activated over an extended period. While acute inflammation is a natural and protective response to injury or infection, chronic inflammation becomes a silent and destructive force that contributes to the development of serious diseases. The primary culprit behind clove tea-induced inflammation is eugenol, the active compound in cloves. While eugenol has anti-inflammatory properties in controlled amounts, overconsumption or improper preparation can disrupt the balance and provoke irritation in the digestive tract, oxidative stress, and even immune dysregulation. For example, consuming clove tea in high concentrations can irritate the stomach lining, leading to a localized inflammatory response that may spread systemically if repeated over time. One of the most dangerous outcomes of chronic inflammation is its role in cardiovascular disease. Prolonged inflammation damages the inner lining of blood vessels, leading to the formation of atherosclerotic plaques, fatty deposits that narrow arteries and increase the risk of heart attacks and strokes. Imagine thinking you're improving your heart health by drinking clove tea, only to find it's quietly contributing to the buildup of these dangerous plaques. Chronic inflammation is also a key driver of type 2 diabetes, as it interferes with insulin signaling, making it harder for cells to absorb glucose from the bloodstream. This insulin resistance worsens blood sugar regulation and exacerbates the risks associated with clove tea's hypoglycemic effects, creating a vicious cycle that accelerates metabolic dysfunction. Additionally, arthritis and other joint disorders are often fueled by inflammation. Consuming clove tea improperly can exacerbate joint pain and stiffness, particularly in individuals already prone to these conditions. The inflammation affects not only the joints, but also the surrounding tissues, reducing mobility and quality of life over time. One of the most alarming connections between chronic inflammation and clove tea misuse is the link to cancer. Persistent inflammation can damage DNA, promote the growth of abnormal cells, and create an environment conducive to tumor development. For example, long-term irritation of the digestive tract from clove tea could increase the risk of gastric cancers, while systemic inflammation could elevate the risk for breast, colon, or prostate cancers. Beyond physical health, inflammation impacts mental well-being. Chronic inflammation in the brain, known as neuroinflammation, is associated with conditions like depression, anxiety, and even Alzheimer's disease. A person experiencing persistent fatigue, mood swings, and cognitive fog may unknowingly have inflammation driven by a habitual overconsumption of clove tea. Chronic inflammation also weakens the immune system, making it harder for the body to fight infections and recover from illnesses. For instance, a simple cold could linger for weeks, or minor wounds might take significantly longer to heal. Over time, this weakened state increases the risk of complications from everyday health issues. What makes chronic inflammation particularly dangerous is its subtlety. The symptoms, fatigue, joint discomfort, digestive irregularities, often go unnoticed until significant damage has occurred. This insidious nature means that individuals may continue consuming clove tea, unaware of the havoc it is quietly wreaking on their body. Drug interactions, complicating treatment. One of the less obvious but equally dangerous risks of consuming clove tea improperly is its potential to interfere with medications. Clove tea contains active compounds, primarily eugenol, that can alter the way certain drugs are absorbed, metabolized, or excreted by the body. This can lead to unpredictable side effects, reduced efficacy, or even toxic overdoses of medications you rely on. The most significant concern is clove tea's interaction with anticoagulant drugs like warfarin, aspirin, or heparin. As mentioned earlier, clove tea has natural blood-thinning properties, which, when combined with these medications, can dangerously amplify the effects. For instance, a person taking warfarin to prevent blood clots may drink clove tea daily, unaware that this combination increases their risk of severe internal bleeding, such as a stomach hemorrhage or brain bleed, even from a minor injury. Clove tea can also interfere with diabetes medications, including insulin and oral hypoglycemic drugs like metformin, because clove tea can lower blood sugar levels. Consuming it in combination with these medications can lead to hypoglycemia, a dangerous condition where blood sugar drops too low. Imagine diligently managing your diabetes with medication, only to find yourself confused, shaky, and unable to function after drinking clove tea. Another concern is its impact on painkillers and anti-inflammatory drugs such as ibuprofen or acetaminophen. Eugenol can enhance the effects of these medications, increasing the likelihood of side effects like stomach irritation, ulcers, or even kidney damage. Conversely, clove tea can also slow the metabolism of certain drugs, causing them to accumulate in the body to toxic levels. For instance, acetaminophen toxicity can result in acute liver failure, a life-threatening condition. Clove tea's antibacterial properties can also interfere with antibiotics, particularly those that rely on gut absorption for effectiveness. By disrupting the gut microbiome, clove tea may reduce the absorption of medications like amoxicillin or ciprofloxacin, leaving infections inadequately treated. This not only prolongs recovery, but also contributes to the development of antibiotic resistance, a growing global health concern. Additionally, clove tea can impact antidepressants and antipsychotics, particularly those processed by the liver's cytochrome P450 enzyme system. Eugenol can inhibit these enzymes, causing medications like SSRIs, e.g. sertraline, fluoxetine, or mood stabilizers to build up in the bloodstream, increasing the risk of side effects like drowsiness, nausea, or serotonin syndrome, a potentially life-threatening condition. For individuals on thyroid medications like levothyroxine, clove tea's effects on digestion can alter the absorption of these drugs, leading to imbalances in thyroid hormone levels. This can result in symptoms like fatigue, weight gain, or palpitations, making it difficult to manage thyroid disorders effectively. Clove tea also poses risks for those taking immunosuppressants, such as transplant recipients or individuals with autoimmune diseases. Eugenol's interaction with these medications can weaken their efficacy, increasing the risk of organ rejection or flare-ups of autoimmune conditions. The problem isn't just with prescription medications. Clove tea can also interact with over-the-counter supplements, such as those containing iron, calcium, or magnesium. Eugenol can inhibit the absorption of these minerals, leading to deficiencies over time. Imagine this scenario. You're taking a carefully balanced regimen of medications and supplements to manage multiple conditions, and you add clove tea to your routine for its perceived health benefits. Over time, you notice your medications don't seem to work as effectively, or you experience side effects you've never had before. The culprit? An unassuming cup of tea. Psychological effects? A vicious cycle. While the physical risks of improperly consuming clove tea are significant, its effects on mental health are often overlooked. However, These psychological impacts can be just as debilitating, creating a vicious cycle that affects overall well-being. One of the primary ways clove tea can impact mental health is through its indirect effects on energy levels and cognitive function. Chronic fatigue caused by issues like nutrient deficiencies, hypoglycemia, or liver damage can lead to brain fog, making it difficult to concentrate or process information. Imagine going through your day feeling sluggish, unable to focus, and constantly forgetting things, all because of a daily clove tea habit that you thought was beneficial. Hypoglycemia, a common risk with improper clove tea consumption, also has direct psychological effects. Low blood sugar levels can cause irritability, anxiety, and even panic attacks. For example, a person might find themselves snapping at loved ones or feeling overwhelmed by situations they usually handle with ease, unaware that these emotional swings are linked to their tea consumption. Prolonged nutrient deficiencies, particularly of vitamin B12, magnesium, and iron, can further exacerbate mental health issues. For instance, low magnesium levels are associated with heightened stress and anxiety, while B12 deficiency is linked to depression, memory problems, and even paranoia in severe cases. These deficiencies create a feedback loop, where the physical effects of clove tea misuse fuel psychological distress, which in turn makes it harder to identify and address the root cause. Chronic inflammation caused by clove tea misuse can also contribute to neuroinflammation, or inflammation in the brain. This condition has been linked to serious mental health disorders, including depression, anxiety, and Alzheimer's disease. Over time, neuroinflammation damages neurons and disrupts communication between different parts of the brain, leading to cognitive decline and mood instability. Consider this scenario. Someone drinks clove tea daily for its supposed calming effects, but begins to experience persistent feelings of sadness and hopelessness. Over time, they notice their memories slipping and their reactions to stress becoming more extreme. These symptoms may initially be attributed to aging or external stressors, but they are, in fact, a direct consequence of the systemic and neurological effects of clove tea. Sleep disturbances are another common psychological effect. Improper clove tea consumption can disrupt sleep patterns, particularly if consumed late in the day or in high concentrations. The tea's impact on blood sugar levels, coupled with digestive discomfort, can make it difficult to fall or stay asleep, leading to insomnia and daytime fatigue. Over time, poor sleep quality contributes to heightened stress, irritability, and reduced cognitive performance. Lastly, the psychological toll of dealing with persistent physical symptoms caused by clove tea misuse, such as chronic pain, digestive issues, or fatigue, can lead to health-related anxiety or depression. Imagine feeling unwell every day, but not understanding why, leading to a spiral of worry that further impacts your mental health. This vicious cycle of physical and psychological symptoms creates a significant burden on overall quality of life, making it essential to recognize and address the root cause. The good news is that these effects are preventable by understanding the risks of clove tea and learning how to consume it safely. The proper preparation. How to safely unlock clove tea's benefits. Now that you're aware of the potential dangers of improperly consuming clove tea, it's time to learn how to prepare it correctly. With the right method, you can unlock the numerous health benefits of this powerful tea while avoiding the risks that come with misuse. 1. Use the right quantity. The first step to safe consumption is moderation. Clove tea's potency lies in its active compounds, which can be harmful in large amounts. Use no more than 2 to 3 whole cloves for a single cup of tea. Overloading the tea with cloves increases the concentration of eugenol, which can lead to the adverse effects we've discussed. 2. Proper boiling technique. Add the cloves to 1 cup, 250 milliliters of water, and bring it to a boil over medium heat. Once the water reaches a rolling boil, reduce the heat and let the cloves simmer for 5 to 7 minutes. This duration is enough to extract the beneficial compounds without over-concentrating the tea. Boiling for too long can release excessive oils, increasing the risk of irritation and toxicity. 3. Add soothing ingredients. To balance the strong properties of clove tea, consider adding ingredients that provide additional health benefits and enhance the flavor. Ginger. A small slice can soothe the stomach and reduce irritation. Honey. A teaspoon of raw honey can sweeten the tea and provide antibacterial properties, while also helping to coat and protect the stomach lining. Cinnamon. A small stick or a pinch of ground cinnamon can add a comforting flavor while supporting blood sugar regulation. 4. Strain the tea thoroughly. After simmering, strain the tea to remove the cloves and any residue. Consuming the cloves directly or leaving them in the tea can increase the risk of overexposure to eugenol. 5. Drink in moderation. Stick to 1 cup per day, especially if you're new to clove tea. Consuming more than this can increase the likelihood of adverse effects, particularly for those over 50 or with pre-existing health conditions. Always drink the tea after a meal to minimize the risk of stomach irritation and blood sugar drops. 6. Avoid drinking on an empty stomach. Clove tea is best consumed after eating. Drinking it on an empty stomach can intensify its impact on your digestive system, leading to heartburn, nausea, or even ulcers over time. 7. Limit duration of use. Clove tea is not meant for long-term daily consumption. Use it for short periods, such as a few weeks, to address specific health concerns like mild digestive issues or cold symptoms. Long-term use increases the risk of cumulative toxicity and nutrient absorption problems. 8. Consult a healthcare professional. If you're taking medications, have chronic health conditions, or are pregnant, consult your doctor before adding clove tea to your routine. This is especially important if you're on blood thinners, diabetic medications, or have liver issues. 9. Listen to your body. Pay attention to how your body reacts. If you experience any unusual symptoms, such as dizziness, stomach discomfort, or skin irritation, discontinue use immediately and seek medical advice. By following these steps, you can enjoy the health-boosting benefits of clove tea without falling victim to the hidden risks we've explored. The key is preparation, moderation, and attentiveness to your body's signals. Ready to start brewing your tea the right way? Take control of your health and enjoy this powerful natural remedy safely. This is Dr. Health, and I see you next time.